New COVID-19 vaccines are now available at pharmacies and clinics across the country. Doctors hope this announcement will encourage people who are at higher risk from getting sick, like the elderly, to get them now. But this time, those without insurance could pay up to $200 for that vaccination. Here with us on more about the vaccine and other important health headlines is CittaMed founder physician, Dr. Lipi Roy. Dr. Roy, great to see you again.
Good morning, Hena. How are you?
I'm great, better now. So there's an updated COVID-19 vaccine amid a summer surge in cases. You and I have talked about this before. What should people know who are considering getting this vaccine before the weather gets a lot colder?
Yeah, so I'm glad we're bringing this up because in August, the FDA approved the updated COVID vaccines from Moderna and Pfizer for the upcoming fall season, mostly to target the KP2 variant of SARS-CoV-2, which is a descendant of JN1, which drove most of last winter's surge. This will most likely be an annual process, just like the flu vaccine is. And an updated vaccine from Novavax is also expected to be approved by the FDA later this year. So who should get the vaccine? You pointed out, you were alluding to higher risk individuals. So yes, higher risk individuals, which includes older adults, young children, immunocompromised individuals, and pregnant women and pregnant people. But really, the CDC recommends that all people in the United States that are 6 months and older to get this updated COVID vaccine to prevent the surge, or to really to address the surge that'll be coming this fall and winter, and to get the flu vaccine as well, Hena.
Doctor, I have to ask you, for people without insurance, we know it's no longer free at pharmacies. It could be $200 for this shot. Do you think that will impact how many people get the shot this season?
Yeah, it's unfortunate that for the first time, the pharmacies will no longer offer the COVID vaccine free of charge for people without insurance. And that's about 26 million Americans. So why is that? Federal funding ended for the CDC's Bridge Access Program, which provided free vaccines for uninsured or underinsured individuals. And the cost, as you point out, could be up to like $202. So, but note that the CDC just announced last month that it's distributing $62 million to state and local public health departments to provide free COVID vaccines to those with inadequate or no coverage. So keep an eye out for that.
I already got a text from my pharmacy telling me the vaccines are available. Should we be getting the vaccination right now, doctor, or should we wait until the flu shot is available as well?
So great question. You can actually get both the flu and the COVID vaccines together. So if you want to just save time and just be efficient, get them both at the same time. But if you want to get one now, it's available. The COVID vaccine, the updated one is available, I think now or as soon as possible. Just get it whenever you can. All I care about as a doctor, just get both vaccines.
Sure, I understand. I do want to switch gears. According to new research by the Journal of American Medical Association, Parkinson's disease may start in the gut. What does that mean, and how big of a breakthrough is this?
Yeah, this is pretty fascinating. I actually reached out to a couple of my GI colleagues yesterday just to talk about this new study. So a study by researchers at Tufts University and Beth Israel Medical Center at Harvard published a study in JAMA. It's a retrospective study looking at about 9,300 patients who underwent an upper GI or upper endoscopy and biopsy from the years 2000 to 2005. And the study found that those with mucosal damage to their GI tract, in other words, the inner lining of their GI, had a 76% higher risk of developing Parkinson's disease. And just for your audience, just as a reminder, Parkinson's is a progressive neurodegenerative disease affecting over 8.5 million people globally, and prevalence has been doubling over the past 30 years. So symptoms of Parkinson's: tremors, rigidity, slow movement, or bradykinesia. We don't actually know the cause. Like, why is this connection happening between the GI and Parkinson's? But we think that the Helicobacter pylori or H. pylori bacteria might be involved, as well as dopamine.
Doc, I am running out of time very quickly. How do we keep a healthy gut?
Great question. So lowering our amount of sugar, because that's been related to overgrowth of bad bacteria, as well as minimizing processed foods and alcohol, and instead maximizing pre and probiotic foods like whole grains, onions, garlic, yogurt, and just other fiber-rich foods. Hena.
Dr. Lipi Roy, thank you so much for the advice. As always, we appreciate it.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.